Okay, Rachel, thank you. Thank you so much for coming on the podcast today. I appreciate you taking the time.
Yeah, absolutely. Happy to be here.
It's great to have you here. Can you just give us a brief intro into who you are and what it is that you do now?
Yes. So I am a registered dietitian and I work mostly with individuals that have eating disorders or disordered eating. I work a lot with food and mental health. And I also work, within allergies and sensitivities. And so I'm in my private practice. I'm based on the East Coast of the world. I'm in Hoboken, New Jersey, previously in New York. A lot of my clients are sort of based in New York. And at the moment, I'm mostly virtual. However, I do some walking sessions, which are fun for folks that kind of are in the area. And so, yeah, I mean, a lot of one-on-one counseling. I do some couples counseling, which is really fun as well, family dynamics. And I went to NYU for clinical nutrition after being at NYU previously. So it's just a lot of NYU for me for drama school. So I guess thank you, NYU, although it was a hell of a ride. I'm super passionate about the arts. A lot of the clients that I work with happen to be creatives, actors.
Right.
And I'm just really passionate about, figuring out sort of relationship to food for sure.
Mm-hmm. Yeah, well, I mean, a lot of parallels there between my background in the performing arts space as well, relationships with food, and obviously the kind of like anti-diet kind of message as well, which is why I knew that we'd have a great conversation.
Yeah.
Tell us a bit about that background of performing arts. What was your life like, and then what caused that shift from that into a food journey?
Yeah, absolutely. So sort of growing up, I was, acting, singing, dancing, auditioning, all of that as a young child, and really loved it and loved to be on stage and just perform and sort of the joy of that. And I think I just wasn't really privy to the business side of it. And I think as I got a little bit older, or even just throughout the journey, I just would notice the way that casting directors, agents, managers would speak to me, speak to colleagues, speak to each other, sort of the dynamic in an audition room, how there just would be free commentary. And it was, worrisome for me and troublesome for me. And, ultimately, I think too, just sort of the lifestyle of being an actor, I just didn't, for me personally, I just think that, after school sort of auditioning, it was just tough to sort of, as you probably are aware, having callbacks, but then not getting it. And so you're, feeling that your worth, like your resume is sort of your headshot there, and you're sort of all about sort of how you're looking. And so for me, personally, it was problematic. But I knew that I kind of wanted to be on like the helping side of understanding the science behind nutrition to empower myself, but also to empower others. So, I went back to school sort of part-time at first, took a couple of classes. I definitely was not a science gal. So I really had to like sink my heels in, and ultimately sort of loved biochem, which was sort of hilarious. I really did not think that I was going to be someone who loved that. And ultimately, using all of that to work, ultimately one-on-one, I, for a bit, was working in a hospital setting, covering like the psychiatric unit. And I think that sort of gave me exposure to a bit of like the eating disorder world, but also food and mental health, which I'm super passionate about. And so that's kind of all been taken, to my private practice today.
Yeah, of course. I mean, it's just so interesting, isn't it? Like going back a step into that performing arts world, like it's so interesting where it becomes very business-like and very image-centric, doesn't it? And it's so interesting what people feel like they can get away with saying about your physical appearance. I was when I was at drama school, there were concerns about my weight training from a vocal perspective.
Oh wow.
Despite their, having now worked with a singing teacher for the last 12 years, him and I both kind of joke about that now, of how it's kind of very old science thinking that like your muscular tension can affect your vocal production. And actually it was a very different issue in my vocal folds that needed to be sorted out, and now, can sort of speak, project and sing fine. But even the whole, like, you're too big and you need to drop muscle or drop weight, or because you need to fit in with the, if you're going to get an ensemble part, you'll need to look a certain way. And it's like, well, I look the way that I look. Like, can we not work with this?
Yeah.
And it's interesting because, you know, that you then tell yourself a self-fulfilling prophecy of someone who's like, right, okay, you know, like I'm bigger, I don't dance as well, I'm not going to get an ensemble part, and that'll affect your confidence going into auditions and all sorts of things. And I'm sure that you probably went through a similar journey there.
Yeah, absolutely. I mean, it's just, you know, like comments like, you know, Rachel, like gain 20 pounds or lose 20 pounds, like pick one, like you like to be fit into this box. I'd like to think that it's slightly better now in that landscape, but we certainly know there are certain circumstances where it's just not.
Well, it depends on who's casting the show, doesn't it? That's the thing. It depends on what generation they're from. I mean, there was controversy over in Britain around, you know, a popular show known as Strictly Come Dancing, and celebrity chef Gordon Ramsay's daughter was a contestant, and she's not overweight or, you know, big by any means. And there was a radio presenter who called her a bit chubby.
Wow.
You know, who's in his sort of 60s or 70s, I think. And it was just like, you know, why do you feel you have the right? and also, what does it matter?
Yeah.
And yeah, it's just fascinating.
Yeah, absolutely.
So older generation casting directors, I can imagine, definitely have, this look, this image, and all the rest of it.
For
that we have to appeal to. So what made you so disillusioned with that performing arts stage to go into food and nutrition? What do you think switched that mindset for you? What was that light bulb moment?
Yeah, I mean, I'd always been fascinated by food and sort of the science behind it, but was just so afraid. And I think I think I also didn't really know what a dietitian was or what a nutritionist did, and I was sort of researching around, and I was sort of like, it was like a couple of like weeks before the deadline for this master's program. And I thought, what the hell? And let me throw my name in the ring and sort of see what comes. And if it's a little bit like, if it's meant to be, it's meant to be. If I get it, great. And I didn't apply anywhere else. And I kind of just put all my cards, and all my eggs in one basket there. And I think for me, I knew that I needed more and I wanted to help. I think I really realized, that I wanted to be able to, in a way that was personable, not in a way that felt very formal. I wanted to sort of get into the weeds, with people and my clients and say, look, I get it. I understand. This is so hard. And be relatable in that way and be able to assist, but with the backing of science to be like, okay, what really goes down when you have XYZ thing that you're demonizing? Or, how can we talk about it from sort of an evidence-based, like sort of scientific background, as opposed to, Oprah, your mom, some yoga teacher told you that XYZ, like how are we actually getting our information about nutrition, and be sort of like that guiding light for someone. And sort of, I kind of call myself like a food co-pilot with somebody.
Right. I like that. Yeah, I like that phrase. It's that concept, isn't it, of seeing it as a scientist and observational as opposed to judgmental and, dichotomous, which is we get all of these ideas of food from, as you said, from Oprah or your mom or the people down the hairdressers or the magazine or newspapers or whatever. And it's all just so like good versus bad and hyped up and scaremongering. And when you actually look at the scientific responses that a body goes through over certain foods, you can then be very much like, look, this is actually what happens.
Yeah.
And it's like, okay, you can't argue with black and white data, can you? But it's presenting someone with that evidence to help them, because there's so much other evidence out there that will say so many different things.
Sure, you can Google just about anything and get whatever you want to see and by you for sure. But yeah, I think like being that sort of like shepherd of sorts, like kind of with somebody for sure.
Exactly. And that's great. And tell me a bit about, because obviously, going through dietitian, dietetics and coming up with this qualification for you, obviously where you are is very different to where I am in terms of our attitude to food and nutrition. There's a lot of similarities in Western culture, but in terms of like, so for us, we would go to a general practitioner, doctor, if we had like any kind of ailment. And I know from speaking to a lot of my clients that when they go to a general practitioner about any kind of issue, it's always like, let's get you weighed. Let's focus, you need to lose weight, and let's, let's recommend this diet or something like that. And I obviously know that you're very much like, let's ditch diets. Let's get a healthy relationship with food. And so what's that conversation like with you with regards to, you know, your patients who are concerned maybe about their health?
Sure. Sure. Yeah, no, it's a great question. I mean, certainly, if somebody comes to me and they have sort of insecurities about going to see a primary care physician, which honestly, a lot of people do because they're afraid of being weighed. When I was younger, I remember like being so afraid of being weighed at the doctor's office and to hear whatever they were going to say in any direction. So people avoid care. And so I think, you know, for me, I've really curated a list of people that I really trust. So if I'm going to send somebody to a primary care, or if I'm going to refer to somebody, a primary care physician, it's going to be someone that's going to speak my same language. And I'm going to empower that client to say, look, did you know that you could decline to be weighed? And it like blows people's minds that they can actually say, you know, I'd prefer not to be weighed. Or to say, you know, can we do a blind weight? Like, I'd actually rather not know. Can you not say it out loud? Like, to be empowered as a patient, I think, you know, often when we walk into these rooms, we assume these white coats. We kind of assume this sort of hierarchy or this you know, this sense of authority. And I think, you know, empowering, you know, my clients to be asking those questions. And we know there are certain circumstances, of course, where maybe they're dosing a medication where, you know, they say, look, you know, we actually do need your weight at this time, you know, but we can do a blind weight. Like, there can always be a blind weight where, you know, the individual turns around on that scale and isn't privy to that number. Actually, now I'm working with a scale, which is actually pretty cool, called Clear Step, where, you know, since I work virtual, you know, my clients can step on this scale. It gives them no information, and through Bluetooth, it connects to me so that I can monitor those individuals that I need to be sort of following from sort of like a malnutrition standpoint, progress in that way, you know, without them being privy to that number. So it kind of takes that off the table. But yeah, I think it's tough. And I think, unfortunately, at least, you know, on our side of the world, for the most part, and maybe this is changing, physicians might take an elective in nutrition, like if they want. Maybe they're not required to have that education in nutrition. So if somebody comes into an endocrinologist, this happens all the time, and, you know, they have diabetes or they're pre-diabetic, all the time I hear like, cut carbs. And it's such stupid advice. Like, what does that even mean? Or like, and we know, like, it's just lazy. It's just lazy. And I feel like, unfortunately, because they're wearing the white coat, because they have that MD, there's this assumption that, like, kind of what they're saying about nutrition is the be all end all. And I can't tell you how many times that someone will come to me from that kind of circumstance, and I'll be like, okay, like, let's actually talk about carbohydrates. Let's talk about how we need to, like, utilize carbohydrates. And I think, you know, there's only 3 macronutrients, and everybody's throwing shade at like one of them at some point or another. So yeah, I think, you know, ultimately, you know, finding people on your team that actually know what they're talking about and are going to work. Like, I love to work on a team. So working with me as a provider so that we're in service of the patient.
Yeah. Well said. Yeah. And it was interesting. You talked about, like, obviously the ability to obviously get a weight reading without the client knowing, particularly from more of a malnutrition standpoint. And obviously, you know, because we can go down that line of like eating disorders of people trying to control their weight, and if they're underweight and you're trying to refuel them and you know, nourish them properly, like, it can be triggering if they think they're too heavy. And so, like, that's like another side of the coin versus like the stigma of being heavier versus actually being healthy, and how those things don't always correlate. For sure. And it is the shame here in terms of your health practitioner and like our doctors, that they're not as formally trained in nutrition. And even, like, I remember doing my nutrition certifications and qualifications, and there being doctors doing that course as well for that reason, because they're like, you know, I want to be a GP who has this skill set, because we're not. And it was great actually having really detailed conversations with him. He's really great on Instagram as well, actually. I'll send you his details, because he's just so well balanced in that approach, and it's refreshing to see. But talk to us a bit about, because obviously, you know, I talk a lot now around sort of eating skills and using maybe a combination of intuitive eating with other concepts, particularly if people do have a fat loss goal that they want to pursue. I guess, how do you address that conversation with people of like, it's difficult, isn't it, when people want to lose weight and you're like, but, you know, pursuing weight loss isn't going to be that helpful because of
Right.
diet culture
Yeah.
and what that, you know, what that means to their habits.
For sure. I mean, I think, like there's a lot of folks that feel like we're always in pursuit of weight loss. I think like that's just, again, yeah, that's sort of the diet culture element of things. Like we're constantly trying to make ourselves smaller, also like in our voices,
Mhm.
especially women for sure.
Yeah. Yeah. Yeah.
But I think, when somebody comes to me and they say, I want to lose X amount of weight, or I have my wedding, or, whatever the circumstances, what I share is, I don't really focus on the number on the scale, but if we want to look at your relationship to food, if we want to look at the behaviors, because the goals that I'm going to give you, the things that we're going to work on each week are not going to be, pounds. It's going to be, let's look at, your relationship to food in the evening. Let's look at what's happening where you're backloading your energy all day and you haven't had anything to eat till 5 o'clock in the evening. Like, let's look at that. And what I say is, look, like likely the way that you are operating, like your body's not in homeostasis. Like you're not in sort of the body that you are possibly, like that, where your body is operating, in a way where it's functioning at top notch, but we don't know what that's going to look like. So for us to play this game of numbers is going to get in our way. And let's focus on the behaviors and let's create together like non-scale wins. So, maybe it's energy, maybe it's ability to do certain kind of movement, maybe it's joint pain, maybe it's sleep, maybe it's hormonally. So looking at sort of, or GI symptoms. And so to remind them that, like, again, as you said previously, like the number on the scale doesn't give us much information about somebody's health. Like somebody could be in a smaller body and their cholesterol could be high. Somebody could be in a smaller body. I mean, we make all these assumptions, we assume. And when we look at people, there's unfortunately a lot of people have this assumption about somebody's health. But I think, really empowering them for the behaviors that are within their control, because the number on the scale, I mean, to a certain extent, really is not in their control. And I always share to somebody, look, you might have this number in your head, but let's say it wasn't quite that, but you were really like mentally sound and you had energy and you were feeling good, like digestion wise. And you felt, confident, like, but it's not that exact number. Like, what do we think? And so, and you learn a lot about people, sort of how they answer that, how they respond to that. And that's where you can kind of see, like, when there's such fixation on the number, it's sort of the disordered thought processes there.
Yeah, definitely. Because it is just that drilled into us of, like, as you said, everyone's trying to make themselves smaller, fit into smaller bodies, or have a smaller figure or a smaller number on the scale. And we get fixated with numbers on the scale. And I even put up a post about that saying, if you're trying to hit a scale weight that you weighed when you were, 10 years ago, you're just going to be constantly fighting this battle that you're never going to win, because you're a completely different person.
Yep.
And you may have gained more muscle. You're also older, so you are going to put fat on in different areas. Mm-hmm. And you're now comparing yourself to where you were 10 years ago, or where, someone else is. And
Sure.
And it's interesting having conversations with clients where they're like, I look at myself last year and I was still trying to like improve my body, but I look at myself back then and think, oh, wow, I'd love to be there now.
Right.
And I was like, well, yeah, I had a similar battle when I was in my mid-20s and I was really lean. And was still working with a coach to kind of get leaner. And I was like,
right.
I look back and I'm thinking, what was I playing at? But it was just such body dysmorphia because of being stuck in a body image centric world, particularly in competitive CrossFit was my sort of domain. And so just being like, oh, I need to be leaner, need to be smaller.
For sure.
I know that women have the same thing with their voices, as you mentioned, but like, guys feel this pressure too, particularly with like superhero films and all the rest of it. It becomes very, very, very focused on that.
Yeah, I'm curious, for you, I do work with some males and also some individuals, sort of non-binary, but I'm curious, for males or people who are identifying as male, again, like I know that there's can be a lot of shame about asking for help or identifying. I mean, even some of my clients, we don't really call it disordered eating because there's such stigma around that. And it feels like such a, air quotes, like, white girl problem, unfortunately, is the way that I think society like splashes it in movies.
Mm.
in the media. But I'm curious, just your thoughts about sort of allowing us to acknowledge that exactly, of course, men and people, everyone's going through this. Like, no one is necessarily not inundated with all of this, and it can affect anybody. I'm curious about that, because I know that certainly when I have men, they tell me, I'm sitting on your name for a while. Like, I've been thinking about addressing this for a while, and there's just a lot of shame and stigma around this. And as you expressed, a la superheroes, everyone was like, giving me pats on the back for looking amazing and like, oh, my discipline and all that kind of stuff. And you get that for everybody, but I'm curious, like specifically in that CrossFit world, like your thoughts on that.
Oh, I mean, it's huge. Like the podcast I recorded this morning was with a competitive female CrossFit athlete, and actually she kind of went from having anorexia to finding CrossFit, and then went instantly into kind of fueling her body for performance.
Right.
But it became another disordered eating protocol,
right? Like an orthorexia, constant,
counting macros and calories, and and that was another safety behavior for her. And for me, as someone who's always been a sort of a bigger bloke, played rugby all through my sort of teens, which is where it served me really well. But had sort of had parents with sort of a poor relationship with food and sort of different health concerns. Mum sort of always on and off a diet, that kind of thing. So I kind of had a similar sort of yo-yo weight myself.
Yeah.
When you join a CrossFit gym, everyone's training with their shirts off, and you're looking at these athletes who are sort of shredded to the nines, and you think, I want to be like that. I was even privy to jokes about sort of being chubby or fat or overweight or things from people in the same gym that I'm in.
Wow. So it's a culture.
Massively, and so you think, well, if I'm going to be successful at this, then I need to do this a certain way.
Sure.
And for me, when I got my nutrition certifications and found all about sort of calories and macronutrients and things, and worked with a coach on that, I thought that was like, I thought I'd cracked it. I was like, this has helped me, because I'd gone from sort of eating clean and binging to thinking like, right, okay, like I can, I'll have the food that I enjoy, but vary it and still be health focused, but enjoy some cereal or some some cake or whatever, but make it fit my macros. But it very much became that orthorexia, bulimia, of like over exercising, feeling guilty if I didn't exercise, having to hit that calorie target. If I went over that calorie target, there was a sabotage moment, and you look back at it and you're like, oh, okay. And it's difficult as a guy, because I never really asked for help for that. I've come through that through my own further qualifications, for sure, especially around sort of emotional eating, disordered eating, CBT, and things like that.
Yeah.
I've then looked backwards and said, oh, wow, okay, I was probably struggling with that. But as a bloke, and I talk about this with my mental health journey as well.
Yeah.
There is very much still a stigma of like, men don't cry, man up, be more disciplined, and it can lead men to almost blocking out the issue.
For sure.
I think a lot of guys don't realize that they have that problem.
Yep.
And actually they put it down to maybe like laziness or lack of discipline or all the rest of it, as opposed to thinking, oh, actually there might be something deeper here, because as you said, it's not a disorder that they would associate with because of the stigma of it being a middle-class white girl problem.
Sure. Yeah, absolutely. Well said. Yeah.
So any blokes listening to this,
yeah.
It's important.
Yeah.
Massively. And so obviously I can see your parallels there as well. And what I found interesting, Rachel, as well, when we were talking about sort of smaller bodies not equaling health and sort of larger bodies still being health, obviously there's a health at every size movement that's coming through quite aggressively.
Yeah.
And it'd be interesting to hear your take from a scientific point of view on where the lines may blur.
Yeah.
Because from my point of view, from just purely from science and what I've been taught and studied, and observational data, correlational, all these other things, there's definitely, in my opinion, seems to be a line where at a certain point, weight can affect health negatively, even if you're active and sleeping well. But I may have just been taught incorrectly, and I'm interested to hear your view on that as well.
Yeah, I mean, I don't know. Also, too, right now there's a lot of drama with the health at every size movement because of certain individuals that led that movement that were not in larger bodies, that are sort of having other people kind of ghostwrite for them. I won't like name them right here, but I'll share that with you kind of separately too. I mean, so it's a complicated movement written by, unfortunately, like thin white people, which is, I think, problematic that they're the ones, spearheading this movement. That's not correct. And we need to make room for more diverse voices. But I think the way that, and I think, my definition for me, kind of how I think about health at every size, is that, for certain individuals, it's just not going to be possible for them to be in, whatever we're calling on the BMI scale, which I kind of think BS, as sort of normal. So for those individuals, what do they do with that? How, do we believe that there's health available to them? And I think it kind of goes back to what I was saying before, like those behaviors. So if we can have that individual who just, again, will not be that straight size, like be able to sort of go in and buy something off the rack, like, are they still able to be healthy? Again, I've seen some of these dancers that can, do amazing things, and they are in incredible shape. But they're just not in a size that everybody, immediately would identify as being health, because there is, unfortunately, that correlation between health and size that's incorrect. But I think, again, it goes back to the behaviors of like, okay, like, are we, eating food throughout the day? Are we spreading our carbohydrates throughout the day? Are we including, protein and fat more often than not, along with carbohydrates? So it goes, in the intuitive eating space, there is that kind of gentle nutrition part that says, like, look, we're not saying, like you were sort of saying, like, hey, we want to enjoy cake once in a while. We're not saying cake all day, every day. I think, unfortunately, that's like the misnomer. And that's not what happens too. If we say like cake is on the table, there might be like a couple of days where somebody is like very excited and like hits cake hard, but then they're like, oh, I'm over it. Can I have anything else? And I think we found that when we normalize foods, people actually tend to incorporate more nutrient dense foods. So, I mean, I think, health at every size is allowing however your body is wanting to show up, knowing that there is a place for you to be achieving health. Now, I think that regardless of size, if you are engaging in behaviors that are problematic, on any end of the spectrum, then that's not the body you're meant to be showing up in. And we don't know what that body will be until you're really like 6 to 8 months of like really not engaging in those behaviors. So I think, everybody wants to say that somebody, people like to throw out numbers, could this weight be absolutely, healthy? And I think, it's less about that. I think, how can we offer health and well-being, mental health and well-being too? Because I'm glad you brought up mental health, because I think that's part of physical health. I think it's completely intertwined. How do we allow these people who, have been told they are so unhealthy that they constantly need to lose weight? How do we offer them well-being? And I think that's really, to me, what health at every size is about, that no matter sort of what you have going on, there's an opportunity for you to achieve health.
You handled that question really well, by the way. And I couldn't agree with you more in terms of if you're using healthy behaviors, and then you've done that for a consistent period of time, and your body is showing up the way that it's showing up, then that is where you're meant to be. And it's that difference between doing those things and not doing those things. And I think that's the blurred line, isn't it? As you said, like the blurred line between intuitive eating to people that understand it versus that don't. Like, oh, well, how can I trust my intuition? Because my intuition is wanting me to eat 10 cookies. And it's like, well, it's not really. But you've restricted that food for so long. So you'd have to go through food habituation first, and then we'd find you on the other side. And likewise, I think with health at every size, there's definitely people that probably hide behind that blanket.
Sure.
But then it's a case of, well, are you, sleeping effectively? Are you honoring your health with gentle nutrition as well as honoring your satisfaction? Are you honoring your hunger? Are you distinguishing between hunger and emotions? Are you exercising or being active as you'd like to be? Because if we look at the blue zones who live the longest, like I present on a circuit for property investors around nutrition.
Oh, cool.
And I always say, look, like my talk might be controversial for many of you, because you all have different biases, and I'm here to kind of shatter all of them. And I say, I use the blue zones and say, look, like this, 85% of their diet are white potatoes. These guys eat high fat. This lot's mostly vegetarian, but they're all living longer than we are because it's nothing to do with nutrition because, they're living healthy lifestyles.
Yeah. Yeah.
And I think in the Western culture, it's like, we're so obsessed with food. It's actually made us less healthy because of that over obsession and over control of trying to be healthy eaters. It's
Absolutely.
like we're all on orthorexia steroids.
Yeah, that's a great way to put it.
Versus just being like, right, okay, well, actually, what do I feel like today? Embracing that intuitive eating, and then focusing on your behaviors outside of food and having a well-rounded life.
Right. Yeah, absolutely. And I think too, part of health, I'm, remembering too, we know like is socioeconomic status or ability to like have socialization, like those all play. We see, if you give somebody a super nutrient dense diet, but you isolate them, like we're not like, there could be certainly like risk of like sort of heart attack or stroke. And like, people are scratching their heads because, it's super nutrient dense diet that they're eating, but we know that that's not the whole picture for sure.
Yeah, exactly. Yeah, 100%. And it's, that's a really key point, I think, for a lot of people listening to this to take away from that, is that oftentimes we're so focused on controlling things that actually that control can sort of bite us backwards. And when you brought in that mental health picture, because obviously I talked about my mental health journey very, very minorly, as you said, it's a big thing. And they do have an intercorrelation both with your behaviors, with what you're doing, with what you eat, and how you show up in the world. And it's why it's very important to address it, particularly if what you're doing with health and fitness starts to affect your mental health. Yeah. And that's a conversation I'm having a lot these days. It's like, what inputs are you having from social media and your friendship groups or the environment that even you exercise in? Like, is that a good thing for your mental health or a bad thing? Yeah. It's a great thing to be thinking about. I think right now, I'm curious if you find this too on social media. So, in the US, certainly there is, and, not just the US for sure, but there, within dietetics, there's sort of like camps. There's sort of like an anti-diet intuitive eating camp that, I fall in. And there's sort of like a functional nutrition camp for sure. And the sides are brutal to each other. Really. So I'm thinking about like social media and how it affects me. I think right now I'm noticing on social media a lot of air quotes of diet culture, where people saying, it's not diet culture to want to be healthy, but it's aggressive in the way that they're sort of, or they're saying, diet culture is a lazy thing, it's lazy to call things diet culture. So there's even like as a dietitian, there's like as in lots of industries, there's like inflammation to use that word, inflammation on social media from even dietitians. And I think, I'm curious if you experience anything similar from sort of like the functional side of nutrition, which I actually think, if we could in some ways marry the two, we'd have this real sweet spot. Like I'm offering now for my clients stool testing. I'm looking at dysbiosis and overgrowth of, pathogenic bacteria. I think that there's room for that in the treatment of really anybody for any circumstance. But I think, even on social media, even for practitioners, it can get really intense between different sides. Oh, massively. And like, around the whole sort of dysbiosis and stool and things like that, like I'm quite friendly with, there's a woman called Gab Fundaro. I don't know if you know her. She's PhD sort of gut clinician. And I know that she even sort of stepped back from her work with a large company because of their kind of like their massive push towards like macro tracking and meal plans and rigid sort of meal timings and things for performance athletes, especially as she stepped more towards the compassionate coaching and, like away from a disordered eating space, which was a really kind of interesting journey to follow. Yeah. And a similar journey to mine as well, in terms of, because I used to make everyone track macros, and now I'm very much like, it's not that I don't, but I'm very much more compassionate and in tune with those kind of disordered behaviors. Sure. And it's interesting because I still follow a lot of people who are like in that space, and very much macro trackers, but they're evidence-based practitioners who just believe in that method, and that's fine too. And so then where you're from, it's it's so funny that like you almost need to be in a camp of people that has like these absolute views. And it's so interesting where like as nutrition sort of therapists, dietitians, and counselors and coaches and all the rest of it, we teach our clients about the downfalls of being all or nothing.
Totally.
And we're like, think more in the lines of gray, think more on a spectrum. You know, think about doing healthy behaviors all the time, and that will scale up and down.
Sure.
Yet we find ourselves in these absolute camps.
Yeah, it's very
with
true.
Our belief system.
Yeah.
And it's incredible, you know, because there are definitely things in functional nutrition and medicine that I would kind of be like, oh, I'm not sure if that's evidence-based. But then at the end of the day, if someone has something, you know, and then they find a beneficial result from it and they get great results from it and they feel amazing, then, you know, who am I to piss on their chips? Which is a very British phrase.
I was going to say like, wow, I'm going to use that. I've never heard that before.
It's a very British phrase and you're welcome to use it.
I will.
And I used to be that guy. I've been like, actually, there's not evidence to support this. But then how did any new discoveries happen in the first place?
For sure. Yeah. I think it's about, I think, right. In the way that we're speaking to our clients about the gray, as a practitioner, like I want to be exposed to the gray. Like I want to have conversations, of course, with people who don't completely, you know, hold my belief system. I want us to find understanding. I think it's okay that we don't, you know, agree on everything, but I think for us to like on all sides of however we view health and well-being to, you know, consider, I think, you know, ultimately what's best for the client. I think, you know, personally, I have histamine intolerance. So I have sort of late onset, like whole slew of, and it's much more controlled now, like a bunch of food intolerances that I experienced kind of in the past, like 5-6 years. It came out of nowhere. It was very bizarre. And so in looking for assistance, I sort of had to look in the functional space because there's really only 10 years of research on histamine intolerance. I think right now there's a like, I'm noticing maybe it's more because I'm in that sort of echo chamber, but I'm seeing more information about it.
Of course. Yeah.
But it's complicated because there's often a question, I think sometimes in the disordered eating disorder space where they're like, is that really, if it's not an allergy, like, is that intolerance kind of BS? Like what, like, are you, you know, full of shit over there? Like, and I was very much like, no, like these foods, like, I like don't feel so great after eating them. And intuitive eating is also like, how do you feel after eating foods? And I think, you know, that's where it gets sort of interesting. It's like, there's a world where you have true intolerances or certain foods that don't make you physically feel well. But you can also want to have food freedom, like all things can exist and you can, you know, recover from a complicated relationship to food, but also have intolerances that have to be considered. I mean, there was one role that I was going for where I, you know, part of the role was me needing to eat with the clients. I was interviewing. I almost said auditioning. That's funny. I was auditioning for my job. That's what it is, right? And they said to me, they were like, you know, Rachel, like you have to, at the time I was like really suffering. They were like, you have too many intolerances. Like you're going to be triggering to these clients who like can't, and I got it, but it was complicated because I was like, what do we do with these individuals who have these sensitivities that might wax and wane? Because mine certainly did. Do we just write them off and say, oh, it's disordered eating, you know, because really, like the feeling that I get around, you know, some of these foods, and it's a lot better now. It's almost like, an ARFID type thing, an avoidant restrictive. Like for me, shellfish is one of these things that I just got to try again. Like I have this, I'm afraid because of one reaction. And I'm not even certain that was the issue. And so I have to challenge myself to do that. But I think it gets complicated in the camps because people, when there is a sensitivity or an intolerance, I think sometimes sort of the anti-diet community like doesn't buy it or will assume that that's like sort of like a really convenient thing to be saying. But, you know, what do we do if that's actual, you know, truth? And I think, you know, to not get that role, it was very complicated for me because I wanted to help these individuals But, my own food, like the thought that because I had these intolerances, like I was going to be problematic to be eating in front of other clients is sort of interesting.
Yeah. Because if that like looks like a pseudo disorder, or
For
as you said,
sure, which
ARFID
I
or whatever,
understand. I
and
get
triggers
it.
that person, yeah.
But I think they're neat, like, I understand. And I think, suss me out, ask me the questions, or like for any client that kind of comes and says, I'm this, I'm that, we get to sort of like, when did that start, or how, or if somebody says to me, I want to eat in this way, I want to be a vegan, all of a sudden one day, for us to like talk about it, have conversations about it. But I think for the sensitivity piece, maybe less preference sensitivity piece, like we have to acknowledge that some people do, have sensitivities. And I think that's where there's a little bit of this gray. We assume right away that that person might be, it might be sort of convenient for the disorder. And maybe sometimes, yes, I agree. I think sometimes for sure, yes, but sometimes no.
Yeah, I mean, that's well said. It's because it's another really gray area. Because with my teaching and with my education, I've had two different schools of thought on it. I've had one school of thought of being, the IBS kind of lectures and stuff around, there's a whole host of different symptoms that we can go through here. And there's obviously FODMAPs, and there's stress, and there's caffeine and anxiety, and all of these other things that can lead to kind of, problems with someone's digestive system. And then you have the camp of like, don't go down food sensitivity tests online, like IgG being a wrong marker of sensitivity, and all the rest of it. And then from another side of things, as you mentioned, from a building interoception point of view, okay, how does food feel? Because there may be foods that don't agree with you for whatever reason, because we are individual as much as a lot of our DNA is the same. And then you have to honor that and explore that. And is it a genuine sensitivity, as you said, that's not got a lot of research behind it? And is there other things going on? I think it's good to have an open mind about that.
Yeah.
And have a discussion, because I've definitely had conversations with clients about things that are psychosomatic.
For sure.
Of like, oh, I'm definitely bloated after I eat X, or like, oh, I definitely feel terrible because of Y. And it's like, is it the food, or is it the thought of the food, or is it the fact that you're overeating the food? And, but as you said, it's about having that conversation of asking open-ended questions. When did this start? When do you feel it more? What can talk to me more about that feeling? And then you can explore it, as opposed to just shutting the door on it and saying, no, that's not.
Yeah. No, I think for sure. Right. And sometimes it is like gastroparesis, like because you haven't been like feeding it. So like, it's not to say that there couldn't be, and probably like multiple like things. But I think it's a good point to acknowledge, like, even if it is psychosomatic, like they're feeling something, like something.
Exactly.
So we hold space, like, wow, like that, I can imagine that that's super uncomfortable for you. Like, let's look at that. I'm noticing the anxiety, whatever it is, like however you would counsel. But I think, yeah, it's good certainly to keep an open mind, but allow that person, because there's certainly been circumstances where somebody said to me, yeah, no, I'm in my head about this. I'm fine when I eat that. There's been those moments too, for sure.
Yeah. And it's good to have that conversation, as you said, and explore those things, and have the space to be able to do so, because otherwise, how would you find out, right? So, yeah, I think it's good to, as you said, have the discussions with different opinions and explore that gray area, because otherwise that's how we move forward with these things, right? Otherwise we'd just stay in the dark ages, and we'd still think that bleeding people out was a great way to get rid of infections.
Right.
so there you go. Rachel, this has been a great conversation. Thank you so much for taking the time to come on today. Where can people find out more about what you do?
Sure. Yeah, absolutely. So you can find me online at Naartrition. I like to think I'm funny. It's my last name, Naar, N-A-A-R, Trition, like nutrition. So hilarious. Maybe that's British humor, maybe not. Piss in the chips. You can go to rachelnaarnutrition.com. A couple of fun things coming up. There is a free wellness week that I'm a part of, April 11th to 14th. It's all free, all online. So if you go to my website under events, you can sort of have access to that there. And then, I'll just share this isn't out yet, but I'm doing sort of a food and mental health kind of like boot camp week in May, which I'm really excited about. So just kind of stay tuned and poke around for that. But please reach out, any questions, message me, shoot me a note, email, DM. That's all great. I love to interact with everyone. And yeah, thank you so much for having me. This was wonderful.
Awesome. Yeah, I'll put your Instagram link, because where else do people go, right? As well as your website. True. in the show notes, and people can get stuck in.
Perfect.
Thank you.